This video is about OET speaking. Today's episode is going to be a little different. We are not focusing on vocabulary or medical knowledge or fancy templates. We are going to dive into the silent killers of OET speaking. Those sneaky little habits that look innocent but quietly ruin your score. And the worst part, most students don't even realize they are doing it. So grab a coffee, maybe a notebook, and let's go deep. This is the stuff they don't teach in most preparation classes. Okay? So, what do I mean by silent killers here? These are subtle communication issues. They don't scream big mistake, but they slowly eat away at your scores in fluency, intelligibility, relationship building, and appropriateness of language. Think of it like this: you are technically saying the right things, but something about your delivery or connection feels off. Let me list out the main four. Monotone delivery, which means you sound like a robot on low battery, talking at the patient, not with them, like a lecture instead of a conversation, not checking for understanding, assuming the patient gets everything, and not reacting to emotional cues, which means you're ignoring fear, confusion, or stress. So these things don't show up in grammar checklist, but they absolutely show up in your results. Let's break them down. The first one is monotone delivery. Imagine this. Hello, my name is Dr. Lee. I will explain your condition. You need to take your medication twice a day. Please don't worry. Zero emotion, zero energy, and zero connection. Even if the language is correct, it sounds like you're reading a textbook aloud, right? So this kills intelligibility and relationship building. Try to fix it by using natural intonation. Pause, emphasize on keywords, and show some humanity in your voice. Okay? And the next one is the next silent killer, talking at the patient, not with them. Here's what many candidates do. You have bronchitis, take antibiotics. It's caused by infection. You should avoid cold drinks. It sounds like you're giving a lecture to a wall. No engagement, no pauses for questions, and no sense of dialogue. How you can fix this is that you can involve the patient, say things like, does that make sense so far? How do you feel about that option? Would you like me to go over that again? It turns a monologue into a conversation. Exactly what OET wants, okay? And the third silent killer is not checking for understanding. We assume that the patient understands, but in real life, patient miss stuff, especially when they are stressed. OET is testing whether you confirm understanding throughout. So, if you want to fix that mistake, you have to use phrases like, is that clear? Would you like me to explain that in a simple way? I know that's a lot of information. You want me to go over it again? So, by asking these questions, you can check for their understanding whether the patient has really understands what you are speaking. Okay. And the fourth silent killer is very important one, ignoring the emotional cues. Suppose if the patient is saying, I'm scared, this might be serious. And if you're saying, you need to take this medication for 5 days, no, you just bulldoze past a real emotion cue. That's a huge miss on empathy, isn't it? So you have to use phrases like, I completely understand your concern. That's very normal reaction. Let's talk through this together. Okay, so don't just give information, try to give the reassurance. Make them understand that you are with them. Okay, all right, let's see this in action now. Here is the scenario: you are a nurse, a patient has been diagnosed with hypertension. Now you need to explain lifestyle changes and check for their understanding. Once you are done with your response, then we will move on to the next slide. This is a bad response, I could say. First, let me read the response for you and then tell why this one is the bad. Hello, I'm the nurse. You have hypertension. It is a condition where your blood pressure is high. You must eat healthy food. You must avoid junk food and oily food. You should also exercise every day for 30 minutes. Walking or jogging is good. You must also take your medicine every day. Do not skip your tablets. If you don't follow this, you may have complications like heart attack or stroke. You need to reduce your salt intake. Salt increases blood pressure. Also, you should not drink alcohol or smoke. It is very harmful. We will schedule a checkup after 2 weeks. Please follow everything carefully. Thank you. Now, what's wrong here? Even though this response is longer, it still includes all the silent killers. The first one is monotone delivery. In real life, this would sound robotic and flat. Am I correct? And no empathy, no acknowledgement of patient feelings. And I didn't give any check for understanding. I just instructed them what to do. That's it. And no patient engagement here. I did not even ask whether the patient has understand or what does the patient feel. It's just one-sided and no softening language. Everything sounds strict like command. And the result, the content might be accurate, but this response would definitely lower your score. Okay, when it comes to relationship building, tone, appropriateness of language, clarity, and coherence. Now, let me give you the high scoring response. Hi, I'm Sarah, one of the nurses here. Nice to meet you. I understand you have just been told you have high blood pressure. That can feel a bit overwhelming, right? Then you have to pause for the patient reaction. Let me walk you through some simple changes that can really help. First, your diet, reducing salt, fried foods, alcohol can make a big difference. Do you think that's manageable for you? Then you have to pause for the patient feedback. After that, great. The next step is daily physical activity, something like 30 minutes of brisk walking. Does that sound doable with your current routine? Then you are giving time for the patient to react. Then you are continuing. Perfect. And of course, we will prescribe some medication to help bring the pressure down. I will also schedule a follow up in 2 weeks, and you are always welcome to call if you have any questions. Why this response gives you a higher score? Because the tone is very natural and it's emotionally supportive. We have checked for understanding and it's collaborative tone, not a commanding one, right? That's what gets you band A. Okay, so here's your quick recap. Remember, the silent killers in OET speaking aren't always about language. They are about how you say things, how you connect with the patient, and how well you listen and respond. So, if you want to score high, then you have to show emotion, be conversational, check for understanding, and react to the patient feelings. That's what separates an average speaker from a confident, empathetic healthcare professional. So that's all for today's video. Kindly like, share, and subscribe for more OET tips. See you in the next video. Bye for now. Bye bye.